Yeah, thank you all for joining us for this East Coast lunchtime program. I know we've got folks from all over the place, so it's not lunch for everyone. My name is Liza Cuco. I'm the Director of Strategic Communications here at Lifetime Arts. Most of you are probably here because you're familiar with Lifetime Arts, but I am assuming and could tell from the registration list that there's some newbies in the room. Lifetime Arts is an organization that champions creative aging. And creative aging is a practice that combines artistic expression and social engagement to improve our quality of life as we age. And it can be implemented flexibly in pretty much any context. And Lifetime Arts' role is to help organizations of all kinds serving older adults, from state agencies to local nonprofits, succeed at integrating creative aging into the fabric of their community. We are a national organization. Our team is all over the place. And I'm based in Charlotte, North Carolina. Jacqueline Dumont and David Weir, who are helping me with the back end of things today, are in New York. We're all over the place. So if you want to throw in the chat, where you're calling from, what your organization is, please feel you're more than welcome to do that. So we are here today to talk about art as medicine. We probably all know by instinct, if we're on this call, that engaging with art enriches our lives. Art can bring us joy, it makes us laugh, it connects us to our deepest emotions, and it enables us to see a world outside of our own orbit. And making art is one of the most human activities that we can do. It connects us throughout all of human history, to our ancestors, all the way to prehistory. So it's a very human activity. But at Lifetime Arts, we've believed that art making and art learning is more than a nice hobby. We have wholeheartedly believed that art making is an essential component to healthy living and healthy aging. So from a 2006 study with Gene Cohen, which demonstrated arts education's significant impact on improved outcomes, health outcomes for older adults, to the latest report out of the NIH, the science is backing it up that art is good medicine. And to talk about this more, we have a person in the room who is a greater expert than I. We've invited Dr. Jill Sonke, Director of the Center for Arts and Medicine at the University of Florida. She has been instrumental in advancing the field of arts and healthcare, and her research and expertise focus on the transformative power of arts in promoting well-being and healing. Her work has influenced policy, education, and practice, making her a respected leader in the interdisciplinary field of arts and health. So Jill, thank you so much for joining us today.
Thank you. I'm thrilled to be here, Liza. Thank you for inviting me.
So we're going to dive right in. We've got a few questions for Jill, and I think it's likely that we'll have some time left over at the end of the program if folks have any questions or things pop up into your mind. And throughout the program, Jacqueline is going to be putting in some links to different resources and things that we're referring to. And please feel free to use the chat yourselves to pop in questions or comments or anything that comes into your mind throughout the program. So Jill, my first question for you is just like, what got you curious?
So what got me curious about the connections between the arts and health really came pretty early in my life as a teenager. When I first started dancing, I had my first aesthetic experience, which was an experience of absolute transcendence. And I felt so good. Like I felt like, holy cow, I need that in my life every day. I feel so good. And then I was, a year later, I found myself at a performing arts boarding school because I was so swept away in the world of dance. And my roommate had an accident. She was burned. And when she was in the hospital going through treatment, she was a vocal major and a theater major. She would sing to get through the painful treatments. And you know, it made perfect sense to me. And I was like, oh, that's really interesting. And so years later, in 1994, I became an artist in residence in a hospital. And as I was working with patients, I would experience the same sorts of things with them, you know, patients who would dance and describe their pain diminishing or, you know, just seeing their demeanor change. So that got me curious as a researcher. And so I started then doing research into what is it about the arts that can make us feel so good and that can do things like diminish our pain, right? And reduce our anxiety.
I can definitely relate to that because I recently had an MRI for the first time. And that if you've never had one, it is a very anxiety inducing experience. And I was singing to myself during that experience, and that is what really calmed me down. So yeah. Um, your research has looked at both the concrete impact of arts engagement on mental and physical well-being as we age, as well as the impact on an individual's self-perception of aging. So how they view their experience as a person aging, how they view aging, how they think about themselves. Can you talk a little bit more about this aspect of your research?
Sure. I have the pleasure of co-directing the Epi Arts Lab, which is a National Endowment for the Arts Research Lab in partnership with Dr. Daisy Fancourt at University College London. We're really lucky to have amazing partners like the Pab Steinmetz Foundation and Bloomberg Philanthropies and Americans for the Arts, as well as the National Endowment for the Arts. And we do population level epidemiological studies that look at associations or relationships between arts participation and an array of health outcomes across the lifespan. So we use 8 longitudinal American data sets. So these are surveys that are conducted at regular time points across decades with tens of thousands of participants. And they track all sorts of things about people's lives, their education, economics, demographics, health, all sorts of behaviors, things they do, including how often they participate in the arts and what kind of arts they participate in, what kinds of hobbies they engage in. So we use these large data sets. One is the health and retirement study, for example. So we have the data sets that look at older adults specifically. And we do statistical studies. So we're able to control for things like socioeconomics, education, demographics, geographies, age. We can control for all sorts of things. And we can look at different points in the lifespan. And we can set up conditions that are, you know, kind of like controlled trials, right? And we can look at how arts participation impacts a variety of health outcomes across the lifespan and among different groups. So we started in this work by looking at who participates in the arts in the United States. And we found, no surprise, that the social gradients that we're aware of persist in the United States, especially for more formal participation, like going to theaters and galleries, things that are institutionally oriented and have, you know, fees and transportation involved. Those gradients are not persistent, however, not so persistent. They're not absent entirely, but they're not significant for things that happen in our communities and in our homes, right? Like doing knitting, woodworking, art making at home, singing in a choir, those sorts of things. And we've found a lot of really interesting outcomes in relation to aging. We've found things like people who participate, older adults, people over the age of 50, who spend time on creative hobbies and creative activities just once a month or more are 20% less likely to be depressed. And these findings are very similar in the UK, for instance. Daisy has done these studies and she's found effect sizes of between 44 and 48% reductions in risk of developing depression for older adults. She's also found in the UK that older adults who participate in the arts just once a month or more are, I think, it's 25% less likely to develop age-related disability or chronic pain. So we've looked at various things across the lifespan, and we've looked also at the notion of healthy aging. So healthy aging as a construct means the absence of a chronic disease and the presence of self-reported good physical and cognitive health. And so we found that unadjusted in the United States, people who participate in the arts just once a month or more are 80% more likely to report healthy aging. That number is attenuated by different controls, like sociodemographics in particular. But we see really clear relationships between arts participation and healthy aging and the perception of healthy aging across the lifespan. So there are an array of studies, both out of the EpiArts lab and out of Daisy's lab at UCL. There also is some really interesting research that's happened globally in the UK, in Scandinavian countries, Japan, South America, the United States, that looks at mortality and arts participation. And so these studies have been done and redone since the 1990s, and with very large cohorts. And they collectively find that, again, people over the age of 50 who participate just once a month or more, and specifically here in things like going to performances in galleries, right, events-based arts activities, are between 14 and 31% less likely to die early. In other words, they live longer. In the United States, that's 14%. In the UK, that's 31%. And other countries, it lands in between. So again, we realize there's a kind of a sweet spot in arts participation at least once a month or more. We've also found in our studies, we've looked at what is it about those sorts of activities, going to concerts, performances, museums, galleries, festivals. And we've found that the effect sizes that we see around healthy aging and would be so in these mortality studies, presumably, is the socialization involved in going out, the mobility involved in going out. And that's unique. You know, there's a lot of studies that look across participatory, like art making, and, you know, being an observer, which is receptive but not passive, because we're very active even when we're attending performances. And there's different benefits to both kinds of arts participation. We also see uniquely later in life, you know, more arts participation is generally associated with more benefit to the point of employment, we think, right? Sometimes when we're employed in the arts, those benefits are different. With young people, we find the more is better, like we see greater effects for weekly participation among adolescents and young people or daily rather than weekly, and then more so than monthly. So there are dose response relationships that we see as well. And there's a real sweet spot for older adults in participating at least once a month or more.
Can you think of a particular instance that, or a story of a person that you've worked with and how participating in the arts has improved their personal health and well-being?
Yeah, I can think of so many examples, but one that really stands out is a really lovely man named John who came to our dance class for people with Parkinson's disease. And when he came, it was really his wife dragged him as a last resort. He was really depressed. It was difficult to get him out of the house. He was losing hope. He had lost mobility. He couldn't lift his arms higher than his shoulders at that point, which really limits what he could do. He also had the sort of facial, what's sometimes referred to as the mask of Parkinson's disease. So he couldn't smile, and he had adapted things like, crying to express, positive emotion, but that was also really difficult for him. And within 2 months of coming to dance class twice a week, he could lift his arms over his head, he could smile again, and, which has really changed his life. He could do things like get a glass, from the cabinet for himself and hug his wife. And he became one of our star stage performers as well, and developed this whole new identity and social role and group of friends. And it truly changed his life. dancing twice a week. And, again, the socialization is a huge part of that, as well as the physicality.
Yeah, one of the reasons why we just preach the gospel of like being social and making art together, and taking a risk to try something new, like that you're never too old to pick up something new, is because that, like, it really, people shock themselves at what they can do, and defeating that for self-perception of like, oh, I can't do that, that we all have those voices in our heads. And I think especially as people age, those voices can build up. And so having those opportunities is just like really essential for people to surprise themselves, and feel themselves.
Yeah, and I'll just add, Liza, I mean, sort of hearkening back to my first experience of, whoa, this feels so good, I just want to do it every day, right? Like that is a piece of it. We know that we're getting dopamine and endorphins and oxytocin and serotonin, all these amazing chemical responses that do really objective things in our bodies. They are feel-good chemicals that have health benefits. We also know from the amazing research that comes out of like the Sound Health Network, through the NIH, that what's happening in our brains when we engage in the arts, and music has some really special benefits for aging around language and cognition. We're actually developing and enhancing plasticity in the brain and building new neural pathways. And that can do so much for preserving our cognitive and semantic abilities.
Thank you. That's so great. I want to shift over to, we're going to pick this up with a practice that has been emerging in the field of arts and health, which is called social prescribing, or prescribing for the arts. And this is a model where medical professionals can refer patients to arts interventions as part of their care plan. We've been sharing this research, Arts on Prescription, a lot lately, which is something that you collaborated on with Dr. Tasha Golden from the International Arts and Mind Lab at Johns Hopkins, as part of the Massachusetts Cultural RX program. A lot of words there. Could you tell us a little bit more? I think it really leads in from what you've said, but to your take on the value and potential impact of prescribing art?
Yeah. So I'm super excited about social prescribing and involved in so much research, have been for a number of years. We just finished 23 case studies of social prescribing programs in the US in the EpiArts lab. We're doing implementation science studies and a few other studies, and developing resources like the field guide, which I think we'll be sharing out. But social prescribing is exciting in many ways. And I think the biggest thing for me is that I feel that we're on the precipice of what I call the seatbelt moment, a seatbelt moment, right? There are a number of things that have happened in public health in the past 100 years that have been big game changers for our health. We all started wearing seatbelts, right? That reduced road accident mortality significantly. Many, many people stopped smoking. That's had a huge effect. We started exercising in the 1950s. Sport wasn't even really considered exercise, and people didn't routinely exercise regularly, right? We started exercising. We're attending more to nutrition. I actually feel that we're close to a seatbelt moment with the public recognition of the health value of arts participation and creativity. And I think social prescribing is a huge part of that, because when we go to our health providers, because we're not as well as we would like to be, which can be related to a number of things, and it's suggested that we participate in the arts, it can help reinforce that relationship, right? The recognition that this is about my health, right? So social prescribing is also about the co-production of health, between giving more control and power to the patient, to us as individuals, to choose what we engage in that makes us well, and to have support for doing so. So we're seeing different types of social prescribing programs emerge all over the country, and many of them are specifically arts prescribing programs, because there's so much recognition growing around the health value of the arts.
I love that term of the co-production of health.
Yeah, it really shifts from, you know, what's the matter with you to what matters to you? What can we do to help you be well?
In addition to your role at the University of Florida, you're also the Director of Research and Impact for the One Nation, One Project initiative. This is a national arts and health initiative. Can you tell us a little bit about this project and what you guys are aiming to achieve?
Yep. So One Nation, One Project is super exciting, and we're at a super exciting moment. One Nation, One Project is a national arts and health initiative that engages 18 cities across the United States, from small towns of 850 people like Utica, Mississippi, to big cities like Chicago and Washington, D.C., Seattle, the Bronx, Oakland, California. So east to west, two Hawaiian Islands, 18 communities that are centering the arts and artists in cross-sector collaboration between public health and arts and culture sector, and in most of the communities, municipalities as well, demonstrating how the arts and arts participation can be brought to bear to build social cohesion and well-being and health in communities at scale. So these 18 communities are doing incredible, incredible things. And on July 27, they will each culminate in a big spectacle, like a festival or performance or parade. They're big, unique events in each of the 18 communities, and they'll all be spotlit through media to create a national narrative that is a collection of hyper-local narratives of arts and health. So we're hoping that will contribute to that general public awareness that I referred to. And in our research team, we're measuring the changes and impacts on social cohesion and on well-being and health that result from this 2 years of work that these communities have done to arrive at July 27. So you can follow One Nation, One Project and our media campaign, our communications campaign called Arts for Everybody. And you can be a part of this movement on July 27.
So if you go to the link that Jacqueline's put in the website, you'll get to a map so you can see where these projects are happening. So hopefully folks on this call can go to some of these events. And beyond following your social media, is there something that folks can do no matter where they live to participate in the research that is supporting this project?
Yeah, we are super excited to have made some, again, I think big, exciting changes in research. We hired 2 incredible designers from Tactile Pictures, Nizma Zaman and Derek Chung, and they built an artified survey app for us. So one of the surveys that we're doing in this app is a national survey, and it's actually designed to generate advocacy data. It's a 1-minute survey, and I think that link can go in the chat. I want to invite you to take it. It literally takes a minute, and at the end, you get information back about how the arts and health are related, and communities get data back so that they can advocate for more investment in the arts. So the survey generates data like X% of people in our community understand that arts participation contributes to well-being. X% of people in our community want to participate more in the arts for their well-being. And so you can take those data to your local powers that be and say, look, people understand and people want to be able to do this. We need to provide it. So the survey is unique in that way, that it really is meant to generate advocacy data. So please take it and also share it with your communities. You can reach out to me if you're interested in gathering a lot of data in your community. If you're able to get more than 500 responses, we can do a report and give you back your analysis. So do be in touch with me if you would like to engage the survey at scale in your community. It's super easy. It can go out through social media. And because of this app, we developed our own CAPTCHA, and we've had 0 bots. So it can be distributed through social media, which is really cool.
Jill, when is the data collection period end? for the survey?
Great question. End of August. We're shooting for the end of August, so we have a couple of months.
And so we're going to send this survey out to y'all through the email that Jacqueline's going to send after the event. And in addition to the survey itself, Jill's also given us some links to some posters, one in Spanish and one in English, that you can put up if you have a community space that is a part of your workplace or your local community, where people can scan and respond to the survey as well. So look out for that tomorrow in your inbox. So you mentioned in your, talking about this One Nation, One Project initiative, that these are cross-sector relationships. We know this is a conversation about cross-sector relationships because we're talking about arts and health. Sometimes, so incorporating arts and culture into our strategy for overall wellness does require imagination. It requires partnering with people that maybe you're not used to partnering with, and often major changes to the typical way that things are done. Anyone who has tried to do something different knows that it can sometimes take a lot of convincing. So particularly if you work in a context where you're not used to collaborating with artists or arts engagement, or you're an arts organization and you've never collaborated with anyone outside of the arts. So I'm wondering what advice you have for people on the call about how they can start to make the case for this, for the benefit of arts engagement, both to leaders in the arts and leaders in in health in their communities.
Yeah, I always hearken in a question like this, Liza, to my friend Randy Cohen at Americans for the Arts, who always says, no data without a story, no story without data. So there's a lot of truth to especially people, with influence, power, decision makers, gatekeepers, needing data sometimes, right? Needing the statistics, the numbers, but also being human beings who relate to lived experience and stories, the human experience, like you asked me earlier about data, and then you asked me for a story, right? So I would say it's important to bear that in mind, to be prepared with both when you're making a point about the value of the arts, be able to provide data and be able to exemplify it, illustrate it through examples. That can be really important. I would say, there's a couple of resources that I want to mention here. One is the Creating Healthy Communities Through Cross-Sector Collaboration white paper that we released through the ArtPlace America initiative a few years ago. I had the pleasure of serving as a senior advisor to the CDC's Vaccine Task Force Vaccine Confidence and Demand team during the pandemic, and we developed 2 field guides for collaboration between the arts and public health sectors in relation to vaccine confidence. They have recommendations that extend beyond vaccine confidence. And then, of course, the Arts on Prescription field guide that you mentioned earlier, and that I know is linked as well. There are recommendations for identifying partners, reaching out to partners, engaging partners. But I noticed that a lot of people on the call today are from the arts sector. And so I want to encourage you to approach with confidence, right? And to assert in an array of ways that arts and culture as a sector holds as much value, expertise, knowledge, wisdom as the healthcare or public health or municipal or education or any other sector. So I think culturally in the US, the arts have been othered in ways that have devalued them. I think that's shifting. I think the arts are being more widely recognized for the values that they bring across sectors. And I think it's important to assert that, right, in the conversations that we have. And One Nation, One Project is designed to exemplify what it looks like when arts and culture as a sector is at the table with other sectors, when big problems need to be solved and big change needs to be made. So we'll be sharing out the experiences of every community and making that story and those 18 stories available as examples.
And just as a reminder, guys, if we'll share out all these resources, and if there's anything that was mentioned that you didn't think that you see in the email, just let us know. So there, I know there's like a lot of resources that we're talking about here, but we really want to help everyone on this call to be able to make the case for this in their community. Obviously, at Lifetime Arts, we're focused on a vision for creative aging. So if your work was to be complete, what would the future of aging look like in America?
So I would, again, harken back to the seatbelt moment, and I would say that all of us over the age of 50, certainly across the lifespan, but all of us over the age of 50 would, on Sunday, when we're thinking about when am I going to exercise this week, would also think about when am I going to be creative this week, and would make sure that our calendars have arts participation and creative engagement regularly. I also see a future in which our systems that pay for wellness pay for a wider array of resources, including arts and cultural resources. And we're seeing that in some of our social prescribing pilots, like in Newark, New Jersey, in Dallas, Texas, and soon to be in Los Angeles as well. So I see that future and I think it's not that distant.
All right, so thank you so much, Jill. That is all my formal questions. But we'd just like to open it up now to any questions that folks might have that have come up in your mind throughout this conversation. If you could just throw any of your questions into the chat, we'll moderate the questions from there. We have about 5 minutes or so for questions. All right, so we have a question from Russ Grazier. Forgive me if I didn't pronounce that correctly. How large or small of a geographic area is needed to be considered for survey feedback? Is it limited or can it be widespread?
Yeah, we just need a set of zip codes. It can be few or many. So you can define, community in any way you like by zip codes, because that's the information that we collect that locates people. And as long as we have at least 500 surveys, in an area, we're happy to give you back the analysis. So our statistical team will give you back your numbers. So we'll need to be in touch. So please do email me. I'm happy to put my email address in the chat if you're interested in engaging in that way. But yes, any scale of community is fine. At least 500 surveys for us to, just because we have to be measured, we're doing so much in giving back that reporting.
All right, and we've got a question from Abigail Sikeli. So Abigail is an architect working at the intersection of public health and the built environment with a nonprofit called The Happy. How do you perceive physical space related to your work?
This is such a big question, Abigail. Thank you for it. There's a lot of attention here. It's not my area of specialization, physical space, but I would point you to the NeuroArts Blueprint and the IAMS lab at Johns Hopkins University that Susan Magsamen runs. They've just done a big event I feel like it was about 6 weeks ago on the arts and built environment and health. And I believe that it's available online. So that's the International Arts and Mind Lab at Johns Hopkins University. So I would point you there, and I think you get a lot better response there than I could provide today.
Just scanning the chat. So Christopher, I see your comment about wanting some like catchphrases and data and things like that. I don't Jill, you can share what you might have as far as advocacy toolkits go, but I also just want to say that that is something that is also on the forefront of our minds at Lifetime Arts, and we don't have something to share with you yet, but we are really thinking about what tools we can provide to people to help them advocate for this issue. So Jill, is there anything that you could point Christopher to?
I would offer two things. I'll pop in the chat in a second. We have a document that we created in the EpiArts lab, which is like key takeaways, sound bites for some of our research findings, including those pertaining to older adults. We've got more coming. We're just updating that document now, and we've got more pertaining to older adults. I would also point you to the Arts for Everybody campaign. If you're on Instagram or any of the socials, our team has done a phenomenal job of developing those sound bites and ways to invite people to participate, and also clear ways that relate the arts to health. So if you just, scroll through our Instagram on Arts for Everybody, you've got language you can use. And again, if you reach out to me, I'm happy to connect you to our comms folks who can provide more of that for you.
All right, thank you so much, Jill, for your time and your wisdom and knowledge and sharing all that with us. I'm sure things will pop up in everyone's heads after we leave the call today. But yeah, you can all look out for that email from us. If you enjoyed the program today, we're also going to pop a little feedback form in the chat and include it in the email as well. We would really appreciate your feedback. Lifetime Arts hasn't traditionally offered a lot of free public programs like this, but if it's something that you would value, we would love to know. So please take a moment to fill in that feedback form. I also wanted to lift up a new service that we have coming up, which is a community network space, like an online community for folks who've been through Lifetime Arts Creative Aging Foundations training, to continue to build relationships with each other, to get access to more professional development resources, and to have some networking opportunities with other people practicing creative aging in different sectors across the country. If that's something that you would be interested in, you can let us know in the survey, in the feedback form as well. And Jacqueline just popped a link in about that new community. It doesn't quite have a name yet, so we are going to be announcing it soon, and it's going to launch in the fall. So we want to share that information with you. Thank you all for giving us your time. We hope you learned something today, and that you learned something that you want to share with someone else. And please do take the time to share out the One Nation, One Project survey with the folks in your orbit. Right. Thank you again, Jill. Have a wonderful day, everyone.
Thank you so much. Thank you, everyone.